Jackson Anderson. I am the President and CEO of the Ruby A. Neeson Diabetes Awareness Foundation, and today is World Health Day. So I am so excited because I'm going to speak with one of our supporters. She's a participant of our support group. She's also one of our partners. And she is going to bring attention to something very serious. Now, let me explain the purpose of World Health Day. And it's basically to bring attention to important health issues. We all know that diabetes, it's a chronic disease, and it's one of the more prevalent chronic disease, and it is a global issue. So I wanted to talk about some of the complications of diabetes, or another chronic disease that is linked to diabetes, specifically type 2. And it was very interesting to learn about sarcoidosis. Jami, she's been educating me on this chronic disease, and it's linked to type 2 diabetes. There is a correlation, so we may talk a little bit about that. But in recognition of World Health Day, Jami, thank you so much for speaking with me. And I want to know a little bit more about your experience with this chronic disease. So why don't you introduce yourself, and if you can share a little bit about why this conversation is important, because I know it's important to bring attention to something, to this disease.
Absolutely. Good morning, everyone. I'm Jami Greene, and I'm honored to be here today with Mutima. And as she mentioned, April is Sarcoid Awareness Month. And the majority of the people that I know personally and intimately have no idea what sarcoidosis is, because it's not something that's talked about enough. And the first time I ever had heard of it was many years ago. I read that comedian Bernie Mac died from complications of sarcoidosis. And so that was the end of it. That was all I had heard about it. And so my particular diagnosis, and one of the things that I think is important to make sure I say, is that sarcoidosis mimics so many other diseases and illnesses. And so it so many times goes undiagnosed because people, I know a lady personally that was being treated for MS for many, many, many years, and later found out it was sarcoidosis.
Wow.
I met another young lady who had been treated. She had had a hysterectomy because she was told that she had cervical cancer. And later on, after, various tests were done afterwards, it found out it was sarcoidosis. And so basically what it is that the cells in your body group together in what they call granulomas, and they just like constantly feed on each other and eat each other and whatever, and cause inflammation inside your system. Okay. And so it's technically an auto-inflammatory disease that affects your immune system. And so a lot of diseases that people thought they had autoimmune diseases like lupus, it turns out it was sarcoidosis. And it's not easy to diagnose. And honestly, a lot of people, even in the medical field, have no clue what is going on with it. The cause is as varied as the people. It's also known as the snowflake disease, because just as each snowflake is different, each person's experience with sarcoid is different. You and I can both have sarcoidosis and have totally different symptoms, totally different affect everything. It does affect your organs and your skin. I've met people who have it on their skin. They have all kinds of lesions and stuff like that from it. I met a young lady not too long ago who has it in her brain. And so it's affecting her neurological system. And then I met a young lady who's 23 years old, and they found sarcoidosis in her heart, lungs, and in her reproductive area. And so it's horrible. It's a horrible situation because the thing is, there is no cure, and they only can treat the symptoms. And a lot of the medication that they give you to be treat the symptoms create other issues. And depending on where it's located, it can be a horrifying experience. My situation was, I started out having a cough, and it just kept getting worse. But I have had respiratory issues all my life, especially sinus drainage and all that. So we just thought it was more of a respiratory thing going on. And then all of a sudden, I started losing weight. And that's another symptom of sarcoidosis is excessive unexplained weight loss. And so at first I was excited because I wanted to lose weight. I had been saying, oh my God, I need to lose some weight. So it's like, oh, this is great, And everybody started complimenting me. Oh girl, you really dropping that weight. And then it started going like really, really fast. Like within a month, I had lost like 30 pounds. And then I started with the nausea and the vomiting. When I would actually go to my primary doctor at the time, I would literally be sitting next to the garbage can because I was vomiting or dry heaving the whole time. So she said, I'm very concerned about this weight loss. So I was tested for multiple cancers in the abdomen area because of the vomiting and what have you. My colon, my pancreas, stomach cancer, all kinds of things. And all this came back negative. And what happened was the last time she sent me to have an abdominal CAT scan, they accidentally saw some spots in the lower part of my lungs.
Wow.
So the CAT scan CD was sent to my pulmonologist, and she said to me, I'm very concerned about what I'm seeing in this CAT scan. She later explained to me that she was pretty sure it was lung cancer. So she said, I want to have you do a PET scan. Now, a lot of people know what a CAT scan is, but I found out a lot of people don't know what a PET scan is. And basically, what she explained to me is they put you in a machine and it scans your whole body. But because they're looking for cancer, I didn't know this either, but cancer loves sugar water.
Yes.
So what they do is they put a sugar water IV in your body, and wherever you have cancer, it lights up.
Yes. Yes.
So
I always say that cancer, like if you eat a lot of sugar, if you are stressed, a lot of stress, it seems like it attracts. I don't want to say it attracts cancer, but you're right. It lives in sugar. But I didn't know that they use that as a form of testing. So
yeah, I didn't either until she told me that. But, and this is important because you are an advocate for health care in this country. And so I want to point this out, that the healthcare system in this country leaves a lot to be desired. Yes. Because even though my doctor was adamant I need to test her for cancer immediately, she made that request on May 17th. And she had to fight with the insurance company all the way to August of that same year, and they still would not do the PET scan. They said, we will pay for her to have a lung biopsy, which if you think about it, is really stupid because I could get inside a machine for 45 minutes and it's over with. It's way cheaper than getting the operating room, a surgeon, an anesthesiologist, and whoever else is in the operating room. But anyway, I ended up having to have the lung biopsy, which I didn't get the diagnosis until October.
Wow.
So from May to October, I don't know if I'm walking around with lung cancer or not. I went from 185 pounds to 118 without knowing why.
Wow.
And so finally in October of that year, I got the diagnosis that it was sarcoidosis.
Okay.
I think that's something people need to be aware of, because what you may think is one thing, but you need to find out for sure.
Absolutely. And you know what I mean, what I know about sarcoidosis, and I'm going to pronounce it correctly. And this is Sarcoidosis Awareness Month for those that may be watching. April is Sarcoidosis Awareness Month. So, and that's why we're wearing purple, to support those who are living. And I'm sure because it's a chronic disease, and Jami, she has mentioned there, some people, they kind of lost their fight to this disease. What I do know is that it is a collection of really diseases that involves inflammation. So what I wanted to know, because there is a study on its link to type 2 diabetes. Were you diagnosed with type 2 diabetes? And this is an autoimmune disease, correct? Were you diagnosed with type 2 diabetes previously, before your sarcoidosis diagnosis, or after?
Before. I was diagnosed with type 2 diabetes way before the sarcoidosis, okay. Which, again, as you pointed out, because I didn't even know anything about sarcoidosis, I really don't even know how long I had it. Mm-hmm. So I know when I was diagnosed, but I don't know, and so I definitely understand. And I have read about the correlation between the diabetes and the sarcoidosis. And so I just think it's important that anybody that has diabetes, and if you have any symptoms like constant body aches, fatigue, oh my God, the sarcoidosis fatigue is like nothing I've ever experienced in my life. Like, okay. Literally some days I feel like I'm sitting in mud. Wow. And I can't move my extremities. And so, and when you're having a flare up, you have the severe cough and the fatigue and all of that. So if you're having any of those symptoms, I just think you should get tested.
Okay, thank you. And I agree, because I'm learning a lot. And from what I read, basically it's almost like if you haven't been previously diagnosed, then you probably will, or you're pre-diabetic, and then later. So there's absolutely a link there. And I'm going to probably, if you go to fightdiabetesnow.org, I'm going to upload the document that really goes into further detail. It's a clinical trial, I believe, that's going on. So I don't want to really speak a lot on that, because I'm not a nurse. I'm a community health worker. And I don't want to give out any, don't want to give out any wrong information with regard to the science of why there may be a link. But I'm almost sure it's probably because of inflammation.
Oh, yeah, definitely.
Yeah, we know the dangers of that. So I want to talk a little bit about, because it is World Health Day, and the theme for World Health Day is Our Planet, Our Health. And we talk a lot of bit about health, but also some of the environmental factors that contribute to some of the chronic diseases that we face here. And I want to, speak to you a little bit about, the environment and the role that it may have played on your diagnosis.
And it's interesting that you would ask that question, because when I first started reading about it, when I finally got the diagnosis, and then I was handed, this whole stack of papers to read. Mm-hmm. And one of the first things it said was that a lot of people who had been diagnosed with sarcoidosis lived in areas where there was a lot of pollution in the air, like where there's like maybe trains, or like I live in Salisbury, Maryland, where Purdue Farms headquarters are. So there's always a whole bunch of stuff in the atmosphere and in the environment. Mm-hmm. And so I live not too far from a shipyard and stuff like that. And so as I was reading that, I found that interesting, that it is affected by the environment. But the funny thing is, the more you read, like with most chronic diseases, there's always conflicting information. Like one thing that really stood out to me when I first started reading this is that Black women are affected, or the risk of them getting sarcoidosis is higher than other ethnic groups. Really? And I found that interesting.
Yeah.
But the more I get to know people that have sarcoidosis, I'm actually in a support group that has like over 7,000 people in it from around the world. Yeah, and it's worldwide, and there's all ethnicities and races in there, whatever. So I don't really know. Like you said, a lot of things they're researched and studied, and we don't really know. Yeah. How much of this information is correct, but it's funny to me that after I now announced that I had sarcoidosis, I met people that I already knew in this area where I live came to me and said, "Oh yeah, I have that as well. I've been dealing with that for like 20 years." So it's like funny because you never hear anything about it, and then when you get it, you meet all these people that have it. Yeah. Right.
This was the first time I've heard about it. And what I do know, and I'm glad you mentioned the environmental factors, and also the as far as the equitable, basically we talk about the social detriments of health, and we also talk about how it's an unequitable balance. Just like diabetes affects people globally, worldwide, all races can be affected by diabetes, but it is more prevalent in the African American community or people of color. So, but back to the environmental part, I think it's important to acknowledge, because we just had a conversation earlier at the Senior Resource Community Engagement Forum about spring cleaning and kind of the dangers of dust and the dangers of not cleaning. And when we look at environmental factors, if you're not keeping the outside clean, if you have a lot of trash all over the place, or if you live in a building where they may allow smoking, or if you live in a place where there's a landfill nearby or old discarded tires, all of that affects your health. It all affects your health. And we talk about inflammation. So there may be studies out there, but what we need to focus on especially here, World Health Day, hopefully this will be, the start of people taking more care of their environment. Stop throwing, throw your trash away. Understand that this affects your health. So I'm glad that we were able to talk about that and the impact. Yeah. The impact.
Because I do notice that when I go in certain places, even to certain people's homes or apartment complexes, I feel my chest tightening up, and then like and I mentioned this because everybody's there, having this big thing arguing back and forth about wearing masks and not wearing masks. And I mentioned to someone that I have been wearing masks since 2016 when I was diagnosed.
Yes.
Yeah. And so I didn't want to wear it because I looked out of place like a nutcase. And so a couple of times I would go to gyms where my son was playing basketball, which is like a petri dish of germs and bacteria and dirt and whatever, sweaty bodies, all that. And I would take the mask off because I thought I looked really weird, and never fail. Every time within a couple of days or so, I'm in the emergency room because I can't breathe. And so the environment is very important. And even like you mentioned about certain cleaning products, I noticed that when my aide would come and clean, sometimes I had to like go outside or put the window up or something because it affected my breathing. And so I think it's important, like you said, about the environment, because sometimes, and especially lately, people focus so much on food. And I know food is important. And I know that how you are about getting on my case about eating certain things and stuff like that. So I'm not even going to tell you what I had earlier. But certain foods do help with the inflammation, and avoiding certain things help with the inflammation.
Yes. So we do have, and I think that's on our website, but I can get it to you. Jami, I did send her a list of foods because I don't promote a particular diet, I feel that your diet is also based on your environment and other factors like your social factors, especially if you're diabetic and you're taking insulin, if you're taking a fast acting insulin, it really just depends on you individually. We try at the Ruby A. Neeson Diabetes Awareness Foundation, we strive to build long lasting wellness. It's simply treating the disease of diabetes or sarcoidosis. I don't think that is going to help with a person's outcome. So one diet, it really just depends on your situation. So if you have sarcoidosis, you cannot have food. I mean, I'm not telling you not to have chicken.
Yes, you are. You always telling me.
Of course, you can enjoy maybe in moderation, but just know that chicken, certain cheeses, it does affect your body. It affects inflammation. If it's something is producing mucus and inflammation, then that's not good for your condition. So have a diet based on your condition, also based on the medications that you're taking, because medication management is just as important. I would never tell one not to take their medicine. Sometimes your medicine is, you take it, you were prescribed it for a reason. So take your medicine and eat a diet based on that. Understand if there's any side effects to the medicine and eat a diet based on that. So no, I guess I am telling you not to have chicken.
Yes, you are. You're always telling me that.
But we know that chicken, there's it can cause mucus. Even certain, I like wine, but wine, it can cause mucus. So we have to eat and drink based on our condition. So
that's right.
Yes, but we have a plan. We have some foods that can help with sarcoidosis if you're interested. All of the information is at fightdiabetesnow.org. So, and we always have our Ask the Pharmacy session. If you attend any one of our support groups, you have access. That's one of the benefits. You can speak with a dietitian. Again, we render a more innovative approach. So we're going to focus on, we want to know what's going on with you socially. If you have support, because that's very important. Matter of fact, I want to ask you about support. How do you, from your perspective, what's the benefit of having support?
Oh, it's very important. It's very important because when I first started losing the weight, and at the point where everybody was telling me how good I looked and blah, blah, blah. And then one day my sister came down to visit me. And she said, "Oh my God, you have lost so much weight." And because I'm home so much and I basically just walk around in my lounging outfit, hardly ever get dressed up, I didn't really pay attention to it. And then she after she pointed it out to me, I started noticing how stuff was like really hanging, bagging, whatever. And that's when I realized how much weight I had lost. And I really, once it wouldn't stop. Like, it was okay, it was cute for a while, but by the time I got down to 118 pounds, I was severely depressed. Wow. Because in my head, all I could think was, I'm just gonna keep losing weight and then I'm gonna die because they don't know why I'm losing the weight. And when I kept saying, if I get down to 100 pounds, it's over. So I went into a deep depression. So my family was very supportive. They were always telling me, you're fine, we got you, whatever. And so I feel like if I had to deal with it alone, I probably wouldn't even still be here because my attitude was like, I'm just gonna die. I'm gonna tell you this story. It's kind of funny. My niece was coming over helping to bathe me because I literally could not even stand up. The muscles in my legs had started to atrophy. And a doctor said to me, if we don't soon find out what's wrong with you and start treating it, we're gonna have to put you in the hospital and put in a feeding tube. Wow. Because I had got to the point, I couldn't sip water. If I sipped water, it projectile vomited came right back out. So I couldn't drink or eat anything. Wow. And so my niece was over here helping me bathe one day, and she had walked out the bathroom, and I was standing in the bathroom, and I looked in the mirror, and like this space that when you lose weight or before you gain weight, like you had the space between your thighs, right? But
Yes.
like we used to in college or in school, we used to call it the white girl space, right? But as you get older, you lose that space and you forget all about it, right? So I was standing up looking in the mirror and I noticed this space. To me, that showed me how much weight I had lost, even more than anything. And I just lost it. I sat down on the floor and just cried like I was dying, because I really felt like I was dying, because I hadn't seen that space in many years. And so I was like, and my niece comes running back in the bathroom and she's like, what's the matter? What's the matter? Are you okay? What's going on? And I'm just crying and crying, saying the space. Like in hindsight, I sounded like a maniac, but I was just, and she was like, what space? I laugh about it now, but seriously, if I didn't have that support, it made a big difference. And even right now, when I have those days when I hurt and I can't move, for somebody to say, it's okay, just do it, just relax. You don't have to do this, you don't have to do that. It's very important. Support is very important.
I agree. It's important emotionally, socially, and it can also be important, financially. So it's very important. So I want to ask you, because I know we don't have a lot of time, but I'm really happy that we were able to bring attention to sarcoidosis. I want to ask you a little bit about your actual managing of diabetes, and also if those who may have tuned in, because you do have people that you have a message from the chat. I believe it was Terry thanking you for being so transparent and sharing your story. But I do have a message, and for those that Jami did mention earlier, that it can be a misdiagnosis with lupus. I believe you said that, a misdiagnosis, because I always tell people, you're diagnosed with lupus, get a second opinion, because now I know that sarcoidosis and inflammation issues, it could be misdiagnosed, just like Alzheimer's or dementia, because diabetes could cause memory loss. So always get a second opinion. And
sarcoidosis causes they call it brain fog. So all of that right there, that's why you need to get like more than one diagnosis and be clear about what it is that's going on with you.
Yes, absolutely. And because we mentioned diabetes affects your memory. But talk a little bit about, before we leave though, I do want you to share, because we do provide a wellspring of support. And I think it's important to kind of inspire others, especially that are diabetic, to take, better care, manage their diabetes. But can you share a little bit about, your day-to-day in managing type 2 diabetes, or, just your perspective on that?
Well, last week, I did have a follow-up appointment with my primary doctor, my 3-month follow-up, and he made a big deal about how my A1C number was going down pretty good, and he wanted me to keep up the good work. And what I've learned is my family members always tease me, because whenever you come to my house, I had an area where there were always a bunch of snacks. If I didn't have any food, I had snacks. And, my sister used to say, okay, we're not gonna get anything else over here, we'll get some snacks. And then she gets really disturbed when she would come over and I wouldn't have any snacks. But what I realized is that I wanted to live. And so I had to stop eating. Like I could eat 2 or 3 Musketeer bars in a day. I could drink a 2-liter Pepsi like in 24 hours, 48 hours. So I had to decide, okay, not only is this not good for my diabetes, but it's not good for my sarcoidosis either. And so I'm eating less fried foods, less dairy, carbs, because I've never really been a big bread eater anyway, but now I hardly ever eat any bread. And so it's a challenge, because you have to get used, it's like anything else. You can't just wake up one day and say, I'm going to stop eating everything I've been eating all my life. It does take time, but you have to think on, how important is what's more important to me,
Mhm.
eating a whole cake or living to be able to play with my grandchildren. And so I made the decision that I want to live. And so I just cut out everything that I know. I still need, and I do definitely need that list that you mentioned about foods that help with inflammation, because I still have a hard time getting that straight. But because I get so much conflicting information from people about what I can eat and what I can't eat in regard to the inflammation. But I do know that there are times when, like if I do eat ice cream,
Mhm.
every now and then I just get this, I know for like a day or two, I just
Mhm.
feel aching from my head to my feet, everything hurts. And
Yeah.
I know that it's coming from that dairy. Yeah.
Yeah, because of the dairy, I definitely recommend a more plant-based diet, but some people can't really eliminate meat. And we've talked about that before because it can, certain meats can help with the healing process. Now, I don't recommend red meat because that can affect your kidneys, especially when you're diabetic, type 2 diabetic, and depending on your medication. So I'll get the list to you. And I think that's one of the things I really do not to, I mean, I like about our support groups because again, we render a more tailored approach to your situation. So
Absolutely.
yes. So, but Jami mentioned what she said was very important. This is your body. You have to take control of your health and you have to decide if you want to live or not. We have a person here that is managing a couple of chronic diseases. I mean, you're talking about type 2 diabetes, which is very, very challenging in managing itself. And then you have sarcoidosis, which has, another component. So Jami is doing it. I really, really thank you for just taking the time to talk about this. And I wanted to bring attention to this because, again, I know it's linked to diabetes, but also there are thousands, probably millions of people that are facing, that have been diagnosed or will be in the future. So
Right.
any parting words? And again, this is our World Health Day chat. Today is World Health Day, and the theme is our planet, our health. So understand the connection between the environment and your health. Keep our planet clean, throw away your trash. If you live in a community where there's discarded tires, you need to remove them and take better care. Just like we take care of our bodies, it's important to take care of the environment also. So any parting ways from you, Jami?
Well, first, I want to thank you for this opportunity to talk about this because it's not something that's talked about a lot. Still, all these years later, I've met people who've had sarcoidosis for 40 and 50 years. I'm like, what?
Wow.
Like, and again, I never heard of it. So just like there are going to be people watching us today that never heard of it. And so I think it's important now that you've heard of it to research, study it, look it up, learn about it, because you never know. You could be dealing with it or someone you love could be dealing with it. And it could explain a lot of things that you have not gotten answers from your doctor about before. So again, I thank you for this opportunity to talk about it because it is extremely important. And World Health Day is a perfect time for us to focus on every part of our health, mental, spiritual, physical. Every area of our lives needs to be healed and healthy in order for us to live the abundant life that we were designed to live. So thank you.
Thank you. So we're going to end on that note. Thank you so much, Jami. I'm going to stop the screen share. So thank you so much again, Jami. You look beautiful in your purple.
Thank you.
I know your glasses are going to be red because that's your favorite color. So
I have to put red in there somewhere. I think you should send me some purple lipstick.
Okay. We can get you some purple lipstick. So, but thank you all for tuning in. I really appreciate it. If you want to know more about sarcoidosis, I will put the link in the comments or visit fightdiabetesnow.org. I am going to create a page on sarcoidosis because it's something that is coming up, and I want to make sure that people understand its connection connection to diabetes. So
Yes.
our next support group is coming up. So if we can support you in any way, visit us at www.fightdiabetesnow.org. And Jami, she said something great. Focus on your health, your physical health, mental health, and don't forget your environmental health as well.
Yes.
So thank you
Yes.
so much. And I'm
Thank
going to
you.
stop the live. You have a wonderful day, and we'll see you next time. Jami, you
All right.
there.
Okay.
Okay, I think this, okay. And